Hello, I'm Dr. Zarife Daoud, and I'm a pediatric pulmonologist here in Emirates Specialty Hospital. And today we're going to talk about your child's asthma. Asthma is the most common chronic disease in childhood. Did you know that 1 from every 8 children in UAE have asthma? Here in UAE, we have more asthma than in other countries, probably because of the desert environment, seasonal changes, and the use of air conditioner not cleaned properly. Asthma is about inflammation, excess of mucus, and contraction of the muscle that covers the airways, which makes breathing extremely difficult, but especially difficult to get the air out of the airways. So that's why the wheezing and the signs of respiratory distress comes from. There is a whole spectrum of asthma. Some kids have viral-induced wheezing, some have allergy asthma or exercise-induced asthma. But at the end, it comes down to the same main concept. Asthma management these days have changed. There's a very different from the past. So there's no reason why your child with asthma couldn't have a normal, playful life without limitations. If your kid has the talent to be an athlete or play the trumpet, don't let asthma stop your child's huge potential. A correct and early treatment will help control symptoms, reduce asthma attacks, and the most important things, prevent damage to your growing child's lung. What are asthma symptoms? Symptoms are different from child to child. The most common symptom is coughing, shortness of breath, chest pain or tightness. Gets easily tired while playing, and wheezing. Some children's coughing may be the only symptoms and may increase during the night, making it hard to sleep. It can be triggered by exercise, cold air, playing, laughing, crying, and get worse with viral infections. Is there a test that can evaluate my child's lungs? Yes. The spirometry is a pulmonary function test that estimates how well your child's lungs are working and how effective their lungs are to bring the oxygen to the rest of their body. It measures how much air your child can breathe, as well as how easily and fast can blow the air throughout your lungs. This information can help diagnose asthma and decide what treatment is the best for your child. Spirometry is a non-invasive, safe, and painless test. It's done by taking a deep breath and then breathe out very fast and hard through a tube connected to a computer. We can do it in children as young as 4 years old. Is there any treatment for asthma? Yes. There are 2 kinds of medications that play an important role. First, the reliever, and second, the controller medication. So the reliever or rescue inhalers work within a minute, relaxing right away the muscle around the airways during an asthma attack. It is easier to remember that it's the blue inhaler or salbutamol. There is also the controller treatment that has to be taken daily to prevent the inflammation and the mucus that induce the airways to be irritated and hypersensitive, which causes the asthma attack. The controller treatment has to be used every day to work. It doesn't work right away, and this is very important to remember. But in a short period of time, will help your child breathe better. The treatment decision is according to updated international guidelines, and it depends on the age and the type of asthma that your children has. In children, you must use the puffer with a spacer. This is the only way that the medication arrives to the small and distant airways, so it can get more benefit of the medication and your child will need less puff to achieve the same effect. In my clinic, I will help your child reduce asthma symptoms and in many cases make it disappear, improve your child's quality of life in all areas, especially in school and during sports, achieve normal respiratory function, avoid the side effects of medicine using less concentration possible that your child needs, and get an asthma action plan just for your kid.